Good day everyone, I'm Nicole and today we're going to discuss about the drug information retrieval process of Lorazepam. And for the outline, we're going to tackle about the mechanism of action of Lorazepam, its structure-activity relationship, brand names, maximum daily dose, indication, contraindication, possible adverse drug reactions, doses available in the market, and dosage forms. What is the mechanism action of lorazepam? Lorazepam interacts to benzodiazepine receptors or postsynaptic gamma-aminobutyric acid type A ligand-gated chloride channel neurons in the central nervous system at numerous locations. It improves the conductance of chloride ions in the cell by enhancing GABA's inhibitory actions. Let us now proceed to the structure-activity relationship of lorazepam. As you can see on this structure, ring A should include an aromatic or heteroaromatic ring for binding with 5-phenyl 1,4-benzodiazepine 2,1 derivatives. An electronegative group of 7 position of the ring A increases the functional anxiolytic activity. Substitution at 6, 7, or 9 position with electronegative group on ring A will decrease the functional anxiolytic activity. And when heterocycles used as ring A, drug shows poor pharmacological activity. A proton accepting group is essential on ring B for binding with GABA type A. When the proton accepting group is present on the 2 position of the ring B and is in coplanar spatial orientation with ring A, maximum activity is observed. Furthermore, replacement of oxygen with sulfur in ring B results in alteration in the selectivity for binding with gamma-aminobutyric acid benzodiazepine receptors subpopulations, but anxiolytic properties are maintained. There is no effect on agonist activity, but the antagonist activity decreases when methyl 3 position or imine nitrogen of the ring B is substituted. Derivatives having 3-hydroxy moiety are fast excreted. Sterically large substituents on ring B, like tert-butyl group, reduces the receptor affinity and the in vivo activity. 4,5 double bond and 4-position nitrogen is not essential for anxiolytic activity. Benzodiazepine receptors affinity is decreased if C end bond or carbon nitrogen double bond is replaced with carbon nitrogen bond. 5-phenyl ring carbon is not necessary for the binding with benzodiazepine receptor. Substitution at the para position of the ring carbon decreases the agonist activity of the drug. There is no change observed in the agonist property of the drug when there is substitution or ortho position. When 1,2 bond F, the ring carbon is annihilated with an additional electron ring, such imidazole affinity of benzodiazepine receptor increases. Some of the common brands of lorazepam are Ativan, lorazepam intazole, Lorivan, and Loriv XR. And for the maximum daily dose of lorazepam, the daily dose varies from 1 to 10 milligrams, and to assist avoid side effects, the dosage should be gradually increased when necessary or as needed. Let us now proceed to the indications. Indications for FDA approved. Short-term or 4 months relief of anxiety symptoms related to anxiety disorders. Anxiety-associated insomnia. Anesthesia premedication in adults to relieve anxiety or to produce sedation or amnesia. And lastly, treatment for status epilepticus. And for off-label or non-FDA approved indications, rapid tranquilization of the agitated patient, alcohol withdrawal delirium, alcohol withdrawal syndrome, insomnia, panic disorder, delirium, chemotherapy-associated anticipatory nausea and vomiting, adjunct or breakthrough, psychogenic catatonia, and vertigo. Proceeding to the contraindication, lorazepam is contraindicated in patients with an anaphylactic reaction to lorazepam, any component of the formulation, or other benzodiazepines. Cross-sensitivity with other benzodiazepines may exist. It is contraindicated to use in neonates or premature infants, in patients with severe respiratory impairment, except during mechanical ventilation, acute narrow-angle glaucoma, sleep apnea, severe respiratory insufficiency, and intra-arterial administration route. In addition, lorazepam and other benzodiazepines have an increased risk of abuse, misuse, and dependence. These medications are contraindicated in patients actively using illicit substances and drugs, except for use in alcohol withdrawal disorder symptoms and detoxification. Lorazepam and other benzodiazepines are contraindicated in patients with a history of alcohol dependence and abuse and not in remission. Increased risk of fatality with the combined use of alcohol and lorazepam is overused, including death. Injection formulation contains polyethylene glycol, propylene glycol, or benzyl alcohol, so contraindications include hypersensitivity to these excipients. Extended release capsules contains tartrazine, therefore, patients with a history of allergic reaction should avoid capsules. Talking about the possible adverse drug reaction, here are the serious adverse effects of lorazepam: respiratory depression, respiratory failure, seizures, suicidality, dependency and abuse, tachycardia, hypotension, syncope, blood dyscreasis, jaundice, paradoxal reaction, or hyperactive and aggressive behavior, gangrene, or intra-arterial withdrawal symptoms if abruptly discontinued after long-term use, cognitive deficits, behavioral changes, paradoxical agitation, propylene glycol toxicity when using the parenteral formulation in the high doses, hyponatremia, and metabolic acidosis. For common adverse effects, sedation, dizziness, asthenia, ataxia, local injection site reaction, respiratory depression, hypoventilation with IV use, hypotension, fatigue, amnesia, confusion, disinhibition, irritability, libido changes, menstrual irregularities, diplopia, dysarthria, appetite changes, constipation, incontinence, urinary retention, dystonia, ASTL and ALT elevation. In rare instance, lorazepam can use acute liver injury or cholestatic pattern. Lorazepam is available in the market with the dosage of 0.5 mg, 1 mg, and 2 mg. Lastly, the dosage form available for lorazepam includes tablet, injectable solution, extended release capsule, and oral concentrate. And these are the references used in the entire presentation.